The federal government is now just hours away from a potential shutdown, and the tension in Washington is palpable. The city's iconic buildings are illuminated against the night sky, but inside, lawmakers are locked in a bitter standoff that could have far-reaching consequences for millions of Americans. As Congress faces a midnight deadline on September 30th, 2025, the pressure is mounting. Every tick of the clock brings the nation closer to a government shutdown, with both sides scrambling to avoid blame and find a last-minute solution. The new fiscal year begins on October 1st, but without a funding bill in place, much of the federal government will be forced to grind to a halt. Offices will go dark, doors will close, and essential services could be suspended, leaving citizens and federal employees in limbo. At the heart of the standoff is a newly empowered Republican majority in the House, determined to push through their agenda, while a unified Democratic minority in the Senate stands firm in opposition. Both sides are locked in a war of words, each blaming the other for the looming crisis and refusing to back down. The core dispute centers on a temporary funding bill, known as a continuing resolution. House Republicans have managed to pass their version, but Senate Democrats are blocking it, arguing that it fails to protect key priorities like healthcare and public services. Democrats are using the filibuster as a last line of defense, gambling that the public will support their stand to protect healthcare, education, and other vital public services. Outside the Capitol, protesters rally in support, while federal workers and their families anxiously await news of their fate. If a shutdown happens, the impact will be immediate and widespread. It would furlough hundreds of thousands of federal workers, leaving families without paychecks and communities without essential services, close national parks and monuments, disrupting travel plans and hurting local economies, and disrupt government services nationwide, from passport processing to small business loans, affecting everyday Americans in ways both big and small. But this is more than just a budget fight. With the 2026 midterm elections on the horizon, both parties see this standoff as a test of political will and a chance to rally their bases. The outcome could shape the political landscape for years to come, making the stakes higher than ever as Washington counts down to midnight. At the heart of the standoff is healthcare, a defining issue that has shaped American politics for decades, and now it's once again at the center of a fierce battle in Congress. The stakes are high, and the outcome will impact millions of families across the country. Democrats are drawing a clear line in the sand. They refuse to fund the government unless Enhanced Affordable Care Act subsidies are extended, ensuring that working families can afford their health insurance, and unless deep Medicaid cuts proposed by Republicans are reversed. For them, these demands are non-negotiable, rooted in a commitment to protect the most vulnerable. They argue that letting these crucial subsidies expire would cause premiums to spike for over 20 million Americans, making healthcare unaffordable for many who are already struggling. Families, seniors, and young people alike could be forced to make impossible choices between paying for medicine or other essentials. Meanwhile, the proposed Medicaid cuts could strip coverage from 10 million more, leaving children, people with disabilities, and low-income adults without access to basic care. Hospitals and clinics in rural and underserved areas could face devastating losses, further deepening the crisis. Restoring public media funding is also on the Democrats' list of priorities. For them, it's not just about dollars and cents. It's about defending trusted sources of information and resisting what they see as a broader GOP agenda to undermine public goods. House Minority Leader Hakeem Jeffries sums up the party's position with a rallying cry: cancel the cuts, lower the costs, save health care. His words echo through the halls of Congress and energize supporters nationwide. Democrats are betting that if a government shutdown happens, voters will place the blame squarely on Republicans and President Trump, who they accuse of refusing to protect vital health benefits. They believe the public will see this as a clear choice between protecting health care and slashing it. Across the country, activist groups are rallying Democrats to hold firm. Grassroots organizers, healthcare advocates, and everyday Americans are flooding congressional offices with calls and emails, convinced that this is a fight worth having, a fight for the soul of the nation's healthcare system. The Democratic Party is betting big on healthcare, seeing it as both a policy imperative and a political winner. As the standoff continues, they hope their stand will resonate with voters who believe that healthcare is not a privilege, but a fundamental right for all Americans. Republicans, now controlling Congress and the White House, accused Democrats of reckless brinkmanship. They claim to have passed a clean funding bill, only to be blocked by Democrats demanding unrelated policy concessions. Vice President JD Vance calls Democrats hostage takers, framing them as obstructionists willing to hurt the country for partisan gain. Republicans say they're open to discussing ACA subsidies later, but reversing Medicaid cuts is off the table. Their strategy shift blame for a shutdown onto Democrats, emphasizing their own efforts to keep the government open. Speaker Mike Johnson insists the House has done its job, and it's Democrats who are holding up progress. The current crisis is deeply influenced by President Trump's long-standing approach to political brinkmanship, especially when it comes to government shutdowns. His willingness to push negotiations to the edge has become a defining feature of his leadership style, shaping not only his own party's tactics, but also the broader political landscape in Washington. During his first term, Trump presided over the longest government shutdown in American history, a 35-day standoff that left hundreds of thousands of federal workers without pay. He used the shutdown as a bargaining chip, demanding funding for his signature border wall, and refusing to compromise until the pressure became overwhelming. This episode set a precedent for how he approaches high-stakes negotiations. For Trump, shutdowns are not simply failures of governance. They are powerful tools to extract concessions. He views these standoffs as opportunities to demonstrate resolve, rally his base, and force opponents to the negotiating table. Even when faced with criticism or political fallout, he has shown a willingness to endure short-term pain for what he sees as long-term policy victories. This hardline approach has emboldened many Republicans in Congress, who see Trump's refusal to back down as a sign of strength. They believe that standing firm, even in the face of public backlash, can yield results if they remain united behind their leader's strategy. The White House is now signaling an even tougher stance, threatening immediate layoffs and furloughs to maximize pressure on Democrats. By making the consequences of inaction clear, they hope to force a deal on their terms, even if it means significant disruption for federal employees and the public. But Democrats haven't forgotten the lessons of 2019, when Trump ultimately relented after weeks of negative headlines and public opinion turning sharply against him and the GOP. Polls at the time showed most Americans blamed the president for the chaos, a fact that still shapes Democratic strategy today. This history has only strengthened Democratic resolve. They believe that if they can frame the current standoff around popular issues like healthcare and government services, they can once again win the battle for public opinion and force Republicans to retreat. As both sides dig in, Washington is bracing for a prolonged and bitter standoff. Each camp is convinced the other will be the first to blink, setting the stage for another high-stakes showdown with real consequences for millions of Americans. On September 23, 2025, President Trump abruptly canceled a planned meeting with top Democratic leaders. The cancellation signaled a deep rift, with Trump accusing Democrats of bad faith negotiations and using shutdown threats for leverage. Democrats fired back, accusing Trump of running from responsibility and refusing to negotiate. The collapse of talks dashed hopes for a quick resolution, pushing the conflict into the public arena. With both sides entrenched, communication devolved into public accusations and social media jabs. The path to compromise narrowed, making a shutdown all but inevitable. With negotiations stalled, both parties are waging a fierce public relations war. Democrats repeat their message, cancel the cuts, lower the costs, save health care, framing Republicans as threats to American families. Republicans counter, accusing Democrats of holding the government hostage for partisan gain. The hostage-taker metaphor dominates GOP messaging, as they claim responsibility for passing a funding bill. Both sides flood media and social platforms with attacks, each trying to pin blame for the looming shutdown. The rhetoric grows increasingly personal and vitriolic, with each party seeking to win the court of public opinion. As the deadline nears, the blame game intensifies, overshadowing the real policy stakes. The deadlock is marked by two failed funding bills. Republicans passed a clean continuing resolution in the House, expecting bipartisan support to avert a shutdown. Senate Democrats blocked it, insisting any bill must extend ACA subsidies and reverse Medicaid cuts. Democrats then offered their own funding bill with these provisions, but Senate Republicans swiftly rejected it. Both sides have shown what they want, and their power to block the other. The result: total legislative paralysis, with no path forward before the deadline. Congress is at a standstill, and the government is on the brink. While politicians spar, the public bears the brunt of a shutdown. Hundreds of thousands of federal workers face furloughs and lost pay, with ripple effects across the economy. Contractors, local businesses, and tourism suffer as national parks and monuments close. Essential workers like air traffic controllers must work without pay, risking morale and safety. Routine services, passports, small business loans, research are delayed or halted. The disruption is widespread, touching nearly every American in some way. At the heart of the fight is healthcare. If Democrats lose, millions face higher premiums or lost coverage. If they win, they secure a vital lifeline for millions. The human cost is real, even as Washington focuses on political strategy. As the deadline approaches, the outcome remains uncertain. A short shutdown could force a quick deal, perhaps with a temporary extension of ACA subsidies. But a prolonged standoff is possible, with each side betting the public will blame the other. The resolution will shape the rest of Trump's term and the 2026 midterms. If Democrats win on health care, they'll be emboldened for future fights. If they lose, Republicans will claim dominance. The American public waits, caught in the crossfire of a deeply divided capital. The stakes: government funding, health care, and the tone of U.S. politics for years to come.